Covered California Shop and Compare tool is a great place to start to find out what health plans are available to you in your region with potential subsidies. Covered California is broken up into 19 different rating regions, and not all plans are available in all areas. So at the coveredca.com website, you can come over and just click on Shop and Compare, and it'll load the Shop and Compare tool. You can check different coverage years. Right now we'll leave it at 2021. Put in your zip code, and then you want to estimate your household income. This is based on the modified adjusted gross income, which is different than your standard adjusted gross income from your federal taxes because it does include Social Security retirement benefits, disability benefits, tax-exempt interest, and foreign earned income. So when you go through the Covered California application, it will become a little bit more specific. But you want to try and get a good estimate. And then you select the number of people in the household. These are individuals that are on your tax return, either your spouse and dependents, not people that just live with you, grandma, aunts, the renter. These are people that are on your tax return because the subsidies are based on the tax household. Then you put in the ages of the people in your tax household. If someone does not need coverage, you can unclick the needs coverage because maybe they have Medicare or something else, and then they will not be considered in the mix and will not have a subsidy attached to them. You can also indicate if someone is pregnant. If you indicate a member is pregnant, they will not be considered for the subsidies within the mix because they will go into the Medi-Cal MCAP program for pregnant women. You are under no obligation to tell Covered California or Medi-Cal if you are pregnant. Blind and disabled, generally if someone has those conditions, they have minimum essential coverage either through Medi-Cal or Medicare, so they may not be eligible for the subsidies. Then come down, see my results. This is telling you that this is not an application for health coverage. You are just trying to get information. And then you can kind of review what the inputs were up here, and then come down, and at that income amount, all three people are eligible for the subsidy. We can preview plans, and then it takes us to a page about doctors and hospitals. So you can search for doctors that you may want to have in your network because that's very important. And we can come down here, select Dr. Chili, and then you can also select a hospital because not all doctors and hospitals are located or in network for all the different plans. Once you have those set, then you can hit next. Now, these next couple pages talking about healthcare use and prescription drugs, I'm not exactly sure how it factors into the mix other than showing you plans that when you go to the next page that may be more suitable for you. But I just kind of skip these because healthcare is just so specific to the person, and no computer program can ever determine what plan you may need or what is best for your situation. So with these three individuals at that income in this zip code, the Shop and Compare tool says the estimated monthly savings is $1,180. That savings is actually the subsidy, the premium tax credit subsidy. And it is based on the income that you put in. Covered California determines through a formula that is used by the IRS how much an annual premium tax credit would be, and then chop that up into 12 equal increments. and then they forward that to your selected health plan. If you hover over that dollar amount, it will give you the breakdown. So for this particular family, there is $1,130 coming from the federal, and the California premium subsidy is $49.49 for a total savings or subsidy of $1,180. Now you will be reconciling that subsidy amount that you receive on your federal income tax return and your state income tax return. The default for the plans is the bronze. So the number that is shown is after that subsidy. Of course, when you do the application, your subsidy may be different and the final rate may be different. You can go on the left side and just look at maybe only PPO plans if that's what you're interested in, or just HMO plans. You can also filter by metal tier levels and see what is available. You can go change with a yearly deductible if that's what you're interested in, or only Kaiser, or HealthNet, Blue Shield, or Western Health Advantage. Those are the 4 plans that are offered in this particular zip code region. So if you just clicked on Blue Shield, you would only see the Blue Shield plans. Again, if you hover over that savings, it'll give you the breakdown, and then you can see the deductibles. The first number there is the family deductible. The second number is the family prescription pharmacy deductible. You can look at details of the plan and how much the co-pays are going to be. And in this particular situation, Dr. Yee and Sutter Roseville are not in this particular plan. And it'll give you all the different co-pays for the doctor visits, tests, outpatient services. So it's a fairly good breakdown to kind of look at it. But I will say that all of the plans are exactly the same. They don't change. All of the plans are exactly the same. A Bronze 60 plan is going to have the same benefits and coverage regardless of whether it's Western Health Advantage, Kaiser, HealthNet, or Blue Shield. What is different is the network of doctors and the rate. Now, on this particular situation, we selected a doctor and a hospital, and we can see that none of these plans, the Western Health or the Kaiser, include that doctor or hospital. The only health plan that includes Dr. Yee and Sutter Roseville are the Blue Shield PPO plans. So that will help narrow down your decision on what health plan that you may be looking for. But of course, you can see that the Blue Shield plans can be quite a bit more expensive than some of the other HMO plans. Now let's go back and change the income amount to $40,000, household of 3, same ages, same zip code. When we review the results, only 2 people are eligible for the subsidies. The dependent, who is 15 years old, is no longer included in the mix, but is eligible for Medi-Cal. That is because the household income is below 266% of the federal poverty level. Any household income below that, then dependents 18 years old and younger automatically go Medi-Cal. And then we can go and see how that will change the subsidy. So now the subsidy is $1,162.94. And that brings the bronze plan, the least expensive bronze plan here, Western Health Advantage, down to $2, and also Kaiser at $2. You Covered California must charge you at least $1 for your health insurance. Two people, $2. What is going on is that the subsidy is larger than the rate of the health insurance. So if the rate is lower, they cannot give you a credit. They can only apply that amount that brings the rate down to nearly zero, but of course they have to charge you $1. Now, the other thing that is interesting is when we have that lower income, the family is now eligible for an enhanced silver plan. The enhanced silver plans are silver 73, 87, and 94. These have lower cost sharing reductions. A gold plan is considered 80, or that's an actuarial rating where they assume that the average person will have 80% of their health care costs covered during the year. So a silver 87 is better than a gold plan. A silver 94 is better than gold and platinum because platinum is 90. Whenever you're offered an enhanced silver plan, you should seriously consider taking it because it has lower out-of-pocket costs and deductibles. So you can see the yearly deductible for the family, those two people, is $2,800 as opposed to $8,000. The primary care visits are only $15. Lab tests are only $20. So everything is lower with the enhanced silver plans. The co-insurance for outpatient facilities is lower. So always consider taking that enhanced silver plan if it is offered to you. Now, the Shop and Compare tool is great to give you kind of a feel for the plans that are available in your area, but it is no substitute for actually doing an application where you're putting in your, the real information of your income to get a final result. So hopefully that helps you out a little bit on the Shop and Compare tool. And thank you for watching. I'm Kevin Knauss with InsureMeKevin.com.